Hello, all. Welcome to yet another session of You Ask, We Answer with Pran Wellness. I am Anchu Krishna, a counselor at Pran and a VIP Initiative Program Associate. And I have with me today Anupama Rao, a VIP Initiative Program Head at Pran. And today, the topic that we have for You Ask, We Answer is the ignorance and denial surrounding mental health. So as you all know, the last month we had the topic break the silence and stigma about mental health, and seeing there's a lot of stigma and discrimination associated with mental health. There's a lot of ignorance and denial surrounding the mental health issues and mental illness. So today me and Anu would like to discuss certain points about this and answer a few questions which have been forwarded by our volunteers at Pran. Yes, Anu, welcome to the session. Happy to have you again.
Thank you. Thank you, Anshu. Thank you for that introduction. Yes. Also, me and Anshu have been having a host of questions, which we've been putting it together. These are all the questions from our volunteers. We are more than happy to answer these questions for you. We are delighted to receive these kind of questions and give you these answers to the best of our capacity. Yeah. So, Anshu?
Yeah, so Anu, starting with, as I already said that with the so much of stigma associated with mental health, people always ignore, their mental health, though they prioritize their physical health, but they don't prioritize their mental health. So what do you think, what is ignorance and how does it factor into the mental health stigma?
So, like we have this in dictionary, how they define ignorance. So it is a lack of knowledge. That is what it is. So when it comes to our mental health, I would just say just having ignorance is what is, the biggest factor that is affecting mental health is total ignorance. We are all thriving towards giving knowledge towards it. We as counselors, we have to enable ourselves with knowledge every single day. And what we are taking forward is we are doing something but not doing enough is what I would say. We need more and more people to be participating in this activity, in taking mental awareness ahead. We need to take it into our community, into schools, into villages, into even in the urban areas. We need to give all kinds of information that is relevant. So I feel that this is what is lacking just now. Whether it is a simple factor as somebody is going crazy, or saying that somebody is OCD, is all become a very, very common words to use.
Yes,
but,
yes.
All these things in a bearable and in a controllable factor can be used lightly. But these things are actually the bigger factors where there is ignorance too. When they see a person who's just walking up and down a room, or somebody who is all the time, not able to sit in a place, we just can't tell them, that person is an OCD. There are, they need to be given some kind of education towards it. We need to bring awareness towards it. And as we do that is when we can actually achieve the kind of, responses or results that we are trying to do here, part of the mental awareness programs.
Right, right. So as you said, we usually commonly use these terms, if a person is feeling low and we say
Yeah.
that, he's depressed or she is depressed. So I think we should
Yeah.
be very, vigilantly using these terms when we are talking about a person, because it
Yeah.
also it starts stigmatizing that, or oversimplifies the mental illness, as you said.
Exactly. And very simply nowadays, symptoms, they've been dropping words like, that person is a split personality.
Yeah, split personality. Yeah,
See,
yeah, I've heard this. Yes.
so it is like you're not understanding, especially the families who are attached to this person,
Right.
by using these kind of terms, the stigma is attached to the person feels mentally not stable, and that is the kind of challenges that you're facing nowadays.
Right.
Bipolar has been so simply used just because they think they've now learned a new word,
Yeah.
saying oh,
OCD.
schizophrenia, she's an ADHD, that person is a hyperactive, that person is a bipolar. ये सब simple words नहीं है. We as counselors itself are not supposed to use those terms. We are
Right.
not supposed to, categorize that person to that person unless and until we have used measures to measure their illness and we know the severity of it. And that's when we can say those kind of, terms to the person or to
Right.
the family. So I think the biggest stigma that we're having is ignorance, and ignorance is coming out of lack of knowledge. So, that's where I think you and me will agree upon.
Right. And also one thing I've seen that, many a times it's also intentional. As you said, it could be lack
Yeah,
of, as it is lack of knowledge. So it's unintentional. We don't know, it would be that we are not using the terms to belittle that person. But, but it says we are using it in a common terms, but unaware of the fact that you are highlighting or oversimplifying and stigmatizing that mental illness. But then
yeah.
intentional ignorance is much more dangerous,
That's true. That
right?
is true. Intentional ignorance is far more dangerous, and it affects the person who's going through something.
Right.
Depression is a large word.
Mm.
In simple terms, we just say, today I'm just depressed.
Mm.
That is not depression. A person who's actually depressed has feels like as if the whole world is closing down on them.
Right.
That is what is a depression, that they
Mm.
don't want to come out. They feel like they are sinking. So these are all the things that needs to be brought in with a lot of awareness, and we need to do, doing a lot of workshops, going and giving, sessions on, people, educating them on these things. Is all these things that can help. But coming to the other question that our volunteer asked, I would like to ask you, why are some people in denial of the mental health issues, even after diagnosis?
Right.
This is something that's another challenge we have.
Yeah.
After they've been diagnosed also, they are in denial.
Yeah.
So, why are some people in denial? So this is the other question. So Anshu, maybe you can throw some light on this question?
Right. So what I understand, see Anu, it is very common, especially if you consider your physical illness also. Like suppose it happened
Mhm.
in COVID, many people were in shock once they get to know that I am COVID positive. So
True,
it's a
true,
kind of a shock that the person goes into and takes some time to settle in. Okay, I am
true, true.
I am down with this kind of illness. So that's the reason I think that happens with the mental illness as well, or mental issues as well. So because all the more it is too much of stigma is associated within our society, with our family members also, they won't like to open up, and they won't be in a state to accept things that okay, I am depressed, or maybe I have some anxiety issues. Right.
Correct,
So that is
correct.
what I feel, that, the person might be in a shock for some time. It takes time to that person to accept and settle in. Okay. And
Yeah,
obviously, when there is too much of support from the person's family and community, maybe the person will accept the fact that, okay, it's okay to have, stress, or it's okay to have anxiety, or it's okay if you're feeling depressed. So maybe then
true.
there would be chances for that person to open up and say that, okay, I am fine. And also, if you see that when it is related to physical illnesses, we don't associate that person with that illness. We don't say that, this person is cancer. But if it is a
True.
mental illness, we say that this person is a OCD.
Yeah,
So it's
yeah, true,
difficult to separate that mental illness from that person. The person is not OCD.
true.
The person is suffering from that phase. But we
Correct,
use these
correct.
terms. So it's like,
Yeah,
the
that is so
mental
true.
illness. When we talk about mental illness, we associate that person with that mental illness or mental issue.
Yeah. Yeah, I
So,
think, like you rightly said, I think, it is the figuring it out. We
mm,
need to figure it out. We need to figure it out as something that is as a physical thing. This is also a mental thing. And as it's a physical illness, it's a mental illness. If they are going through something, even if a person is diagnosed, right now people are over with COVID. But if earlier that COVID was like a taboo word. They were
right,
so
right.
scared. There was a
Mm,
panic associated with it. So
mm,
right now, they have taken it. Yeah, मेरे को COVID है. It was there. Things like that. So I think, if we give them the time to figure it out, I think they will come to cope with it like any physical illness it is.
mm-hmm.
So yeah, that is what it is. So Anshu, if you say that, how would you help someone who's in denial of mental illness? What would you say there?
So I think first I would let that person to vent out, understand what the
Okay,
person wants. Understand
correct.
what is that denial about. Why is that denial? You
Yeah,
should let that person to open up, give them that space to speak about it. Be that
true,
the
true,
support
true,
to vent it out, whatever is there in their mind. It could be
true, true,
various
true.
factors. Maybe the person wants to accept, but then he or she is scared about what the other people or in the community would speak about him or her, how the
Correct,
people would
correct.
take about. Like in family also, it's
Mm,
all very commonly said that ये तो होता रहता, this is very common, थोड़ा बाहर घूम के आ जाओ, you will
mm,
feel okay. And
correct, correct.
they want, many won't acknowledge what we are going through. So I
Yeah,
would like to
true,
give them that space to to let them know that, okay, we are here for you,
true.
we will listen
Yeah,
to what you want, and what you want is is the utmost priority for us right now.
correct. I think right.
So
You're
acknowledge
rightly.
their feeling. Okay, there is denial. So what is that
Mm,
denial about? First, understand that denial.
yeah, and find a support group, right? Who can
Right, right,
support
right.
you
And
and your family. Yeah, you
yes,
and the family. These kind of support groups will tell you, yes, my child also is going through this.
right.
These are the things I did, and
Mhm.
these are the factors that was affected, and these are the steps I took. So
Mhm.
these kind of support groups, I think, will help largely for a
Right,
person, to who is in denial of any kind of a mental illness. Yeah.
right, right.
Okay. Yeah.
So as said, there's a lot of awareness, especially post COVID. If I see, people are aware that they have to take care
Mhm.
of their mental health also.
Mhm.
But still, in many parts of the world, if you see, mental health is the most neglected health problem.
True.
What major factors do you think is associated, being neglected so much?
Uh, See, what is the negative factor? I would just say because I think people were not willing to accept about the mental illness at all. It was not that it was not there in generations past.
Yeah.
It was always there, but they all, because of lack of knowledge, the ways and symptoms or the steps that were taken was what was ignorant there. But today the studies and the exposure is so much. We are doing so much of research papers on different psychological needs, whether it be a child, whether it be a person who has lost someone, or whether the person is overcoming something, or even to being abandoned. There is
Hmm.
so much of research papers that we are doing. So definitely I would say it needs, like we are telling, the negative attitudes and the behavior has to change.
Right.
The pessimism that is surrounded for therapy. When you are going for a therapy, there is so much of pessimism. There is nobody saying optimistically to you to,
Right.
yes, you need to go for therapy. Rather, they would just say, like you rightly said, take a walk, go out, you will just be all right. These are all terms that has been used. People are not forthcoming when there is therapy, where there is so much of pessimism towards it. And also they are, the parents or the caregivers or the family members are made it into a very secret kind of a scenario. They want to be very they want to keep it among themselves. They don't want to talk about it. So these are the kind of things that I would say the pessimism towards therapy is what it is. And lack of skill. See, there's a lack of skill. When you have a person who is got any kind of a mental illness or are going through something, even if it is depression or anxiety or panic, I would just say there is a lack of skill. We need to give the skill set for the people who are caregivers too, some kind of a training to be given, the stigmatization to be removed. And first of all, we have to lead all the feelings of anxiety, fear, desires, avoidance, social, clinical distance, all these things are all things that are attached to these things. So giving them some kind of an awareness and giving them a skill set how to deal with these things is the most primary thing. And that when you give, for the patient and the provider, what happens is there is a quality of care. When you give the quality of care, the whole thing becomes, the whole scenario is broken down into two. So there is a person who's going through something and there is a caregiver given. So when the skill set is being divided, you understand what the person is going through, give them the skills that needs to be given to them, give them support where needs to be given, and give a skill set to a caregiver so that person knows what to do. Like you rightly said in all these things, just now you said, let them know that they are, it's okay for them to vent or accept that there is something and that needs to be given cure, or do not force them, and all these things, like how you said, these are the things that we need to break it down and give this kind of a skill set. When we give this kind of a skill set, the whole treatment becomes effective. It becomes effective. It is larger receiving. So and similarly I would say, even in the workplace, if in the workplace culture, if we break down and if we give them, not that we are not doing, we are giving them certain skill sets for the managers to use, for the employees to be able to go and talk, to be able to break it down, and the skill set to be given to a manager who is just not done his MBA and come back. He needs to have another skill set of how to hear out of empathy, how to withdraw putting pressure, not to overload, understand what that person is going through. These are all skill set that we give. I think we would be able to break the barrier and give quality care to against or create against the stigmatization that is revolved around mental health. So we have another question here also. So how do we what are the barriers that can be broken when it comes to mental health? So if we have to talk about this, we can have a lot of chat on this. We can talk about it. So Anshu, if you can tell me access to mental health breaks, what would you say here? What kind of an access we have to give to mental health breaks?
Right. So as you are taking upon the example that you gave, like, employees taking breaks, and then there are people in the company that understands or, just have empathy listening to them. But one question arises in my mind, like suppose tomorrow I am feeling not well, I am feeling low and I want to take a break from my work. What do I say? Right? We do have casual leaves and we do have sick leaves. We do apply that, but do we have mental health breaks? And if I'm taking that break, I say that, okay, I'm too much stressed out today, I want to have a break from my work. Will the company accept that? They will say that stress is a daily, it's a part of our daily life. Why can't you handle it? right?
Correct.
So I feel,
Yeah.
there are a lot of barriers here, as you said, but if you have to give an access to quality care related to mental health, I think we should have some mental health breaks as well. This is one idea that I would like to suggest as a counselor as well. you know Being in a family also, if a housewife needs a mental health break, let her have that. Let the family members be supportive of her. Okay, you are stressed out taking care of the family, you're stressed out working, so let's just have a break. It's like just having a me time,
Correct.
right? So
Like,
hmm.
yeah, go on, go on, go on,
Like
go on.
the company should also be supportive of the work culture, should be like that. It should not be stigmatizing, or you should have a positive attitude. As you said, you are talking about the negative attitudes that people have towards when you talk about these things. But if you have a positive attitude as well, maybe in your workplace, in your family, in your community, in your friend circle, if you have this positive attitude carried forward, maybe you can talk about it more openly, and we can say that, okay, maybe I'm physically ill today. So like if you have a headache, you definitely say, I am having an headache, I want to take a break. But we don't say, I am feeling stressed, can I take a break? We don't ask that,
True,
right? So I think
true,
that breaks should be there. Second is, why I feel that, as you said, there's a lot of denial in taking help when it comes to mental health. It could be one reason is because of the financial burden. Like we do have insurance
true.
policies for physical illness, but we don't have anything in place to to take care of our mental health.
Correct.
And also visiting a psychologist or a counselor or a psychiatrist, people don't do that because yes, it costs much for just 1 hour. You know that very well, right, Anu?
Yeah,
So that's
yeah,
the
yeah.
reason people don't go forward to take help, because it's very hard on their pocket, right? So I think
Correct.
that it should be, there should be some policy to lighten this financial burden if people want to seek help. That could be one step I would suggest. And as I said, changing the culture, having positive
Correct.
attitude towards all this thing, changing the workplace culture. Tomorrow if I
Correct.
am saying that I am stressed, so I'm taking a leave today, no one should be making fun of me, or no one should be telling that, okay, she's gone crazy. They will use all kind
Correct.
of terms to define me: she's crazy, she's a fool, and
Right.
all this. And obviously then I would not like to open about and speak about it.
Correct. You're absolutely right. These kind of breaks need to be given, and when a person, not so much in India, but at least in the Western culture, it is very important that the employee is not working more than the stipulated hours. They have strict rules. The companies will lose their license if their employees are working overtime. So
Right.
those kind of cultures are slowly coming into India, but still needs to come more. So when
Right.
they do like that, what happens is, just because a manager has a deadline, he's not going to make his employee overwork. All these things come from there. It is the
Right.
dwindle effect, right? When he is overworked, and when a man or a woman is going to come home, he's going to bring the stress back home. And the person at home, the stress is being passed on to. That
Mm-hmm.
person in turn is not getting a break. Like you rightly said, a
Right.
woman is not given a break.
Hmm.
I just remember one scene from a movie. I remember, somebody said, did you go and ask your sister back home, what does she ever want? She always does things for you.
Mm.
And he said, no, I never even thought I should ask. So he
Yeah.
said, then the person said, go and ask her. And when he went and asked, the sister looked at him and said, what is this stupid question you're asking me? So he said, no, I'm really asking you, what do you want? Then she said, can I get 1 day's break? Can I
Right.
get
Of
1 day's
course.
break?
Actually,
So,
that's a very,
that is what,
very good thing,
yeah.
as you
So,
said. Let us ask our start from our family itself, our friend itself. What is that
yeah,
you want for a day? If you want to wish, what is that
yeah,
that you want? Maybe ask your mother, ask
yeah,
your sister who are like overly burdened with work.
yeah. So, like, make your home domestic help sit down one day, make chai and give it to them and
Right.
say, drink your chai. take these namkeens and eat with it. See, we have to start from somewhere, and everybody, it's a whole world full of culture, and it's a whole world of different people doing different things. So we all have to start to ask and
Yeah.
start to give care, because everybody needs care. And with a changing culture, you need to come to work and I need to come to work, Anchu. We need to depend on somebody else for it.
Right.
So we need to. It's a chain reaction, correct?
So,
So that's what.
one personal question here, Anu. So tomorrow, if you want to take break from, a mental health break, I'm being very
Yeah.
specific, not a sick leave,
Mhm.
not a casual leave, but if you want to take a mental
Yeah.
health break, would you take that?
Definitely, I will, and I would love to go and sit in any of the hills. If I will, if time permits, I will definitely go and sit. If not anywhere, at least I like to go and sit somewhere very quiet.
Right.
In my opinion, for me it could be meditation. For somebody else, it could be prayer. Somebody
Right.
else, it could
Yeah.
be gardening. Somebody else, it could be, taking a walk in the, going to the beach and just standing near the ocean. Might be doing something, but definitely, if I feel there's an overload, I will definitely want to go. And mental stress is for everyone. Even a person as I am, though I'm working for mental health, I need a break myself. I need to take care of myself. If I need to go for therapy myself. So it is a very common thing. It is not something that is, immune to anyone. Anybody and everybody are exposed to these things. One day you feel good, one day you don't feel good, one day you feel up, for the other day you don't feel up. But when it is all the time, when it is in a very smaller manner, it is manageable. When it is not manageable, all
Right.
of us need to reach out for the kind of help that is needed. And this is what we are trying to do by putting it simply in words and putting these things, as making these sessions as you ask we answer, where we are making, getting these questions from volunteers and answering, so that we are able to approach people in the most simplest language. That
Right.
if you need a break, if you need help, do it. Take the break, take help, and that's what we are all trying to say
Yeah.
here. Yeah, that was a good question. I didn't expect that from you, Anshu. But yeah, that was good. Yeah.
But I
So
like the
my
idea
next
of going
question
to
to
a
you
hill.
from another volunteer.
Right.
Yeah, good idea. Correct, correct. So we have another question here, Anju. So the another question is, why is it bad to ignore mental health? So we have a volunteers ask this question. So would you like to answer this question? Why is it bad to ignore mental health?
Taking your last statements, as you said, we are putting it in the simplest of form that, take a break whenever you
Yeah,
need. But then, as you
yeah,
said, we are all overloaded. Yes, we do have our responsibilities at home, at work, and there are, circumstances where we need a break very badly, but we can't take it. And it so
correct,
happens that we keep ignoring and ignoring and ignoring, and then we ignore the mental health. Right? So why is it
correct.
bad? Obviously, why? Because your mental health is related to your physical health. Everyone knows this. So it will
Yes,
definitely
yes,
affect your physical health one day. If you are stressed and you are not taking a break, it will affect your productivity at work. You may not
correct,
able to concentrate. It will affect your focus. It will affect your concentration. It will affect your memory. It will affect your
correct.
sleep. The what you eat.
Yes,
Maybe you may not be eating properly.
yes,
It will affect your sleep
yes,
finally.
yes.
And all these things are small factors which will definitely take you into a bigger problem in future if you neglect it. Right? And as said, all these things that are related to your mental well-being, if they are ignored, it can cause to a higher risk in your physical health as well. Like
Yeah,
recently, have you seen the example of the singer KK? Maybe he was in too
yes.
much of stress, but he ignored that, and that stress led to a heart attack or a stroke. So this stress,
Correct,
if it is not dealt at that time, it may become chronic, and it may lead to a
correct,
bigger problems in future. So that's the reason you should not be ignoring your mental health, be it a very slightest of things. Do little things. You
correct,
don't have to do very big things, as you said. Just go out in the garden,
correct.
or just sit for 5 minutes of meditation, whatever works for you, do that. You don't have to take
Correct.
an entire 2 days or 1 month of holiday for to skip your work if that doesn't work, but small things whichever
Yeah.
matters for you. So that's the thing
Yeah.
what I would like to I'll highlight on why it is important to take care of your mental health. Anything if
Yeah.
you want to
You
add on there?
Yeah. No, no, you rightly said our physical health is totally determined by our mental health.
Right.
Whatever is happening to our body is because of what is in our mind and how our mental state is. So if we take care of our mental health, we will be in better equipped to take care of our physical health.
Right.
So definitely, you're so right in what you said, Anshu. So we have another question here: reasons you shouldn't neglect your mental health. So if I will take this question, I would just say mental illness is more common than we think. We
Right.
think it is, very uncommon. We
Mhm.
think, somewhere out there somebody is going through something. Actually, it is very, very common,
Right.
and we need to just look at it in such a manner. And mental health, like we just know, spoke. It affects our physical health, diseases, injuries, risk are, all these are risk are because of our mental illness, and our body is going to show out what is happening in our mental state. So early detection is so important. Recognizing something is so important, and when you have it detected early, it is always easier to take care of it. So that is what I
Right.
would say.
So yeah, early detection is very important.
Yeah, early detection is so important.
Because it helps to
So,
it helps to seek help at the right time, and it does
uh-huh,
not lead to bigger problems, as said. And as you said, it is more common than we think. I may think that okay, my friend is going through a depression, it might not happen to me, but
correct.
then maybe tomorrow I am also under depression and I don't know that. Right,
Yeah,
so it is
that's
more
true.
common, and if you know that there is some mental illness going on in your family, it is more, predisposed to have you having that mental illness as well. So
True, true.
it's no, it's a sign that you can take care at the right time.
Yeah, yeah, and also I will just say, nowadays the youngsters are having a lot of exposure towards it. Like the people are youngsters have started to say, like when they did not get the course that they wanted or did not get the proper marks. Right now, 10th and 12th board exams are over. So
Right.
they whatever they expected, they did not get that score. Because of that, they are not getting admission in a particular college that they wanted. So when
Mm.
it is this thing, when they feel the youngsters have been pretty open to say, what, I need to go and see a therapist because it is just, I'm just feeling depressed right now, I'm
Right.
feeling hopeless right now. So
Mm.
these kind of things have become very common in youngsters, which we need to applaud, because they are taking half of our burden away by expressing themselves and saying, I need therapy. But the thing is that this is somewhere lost when when in the older sector of people. I do find that these things are not more open towards the elder people. Whether even if somebody is as old as 80 years old, can suddenly start mourning on something that has happened.
Yeah.
Maybe they've lost their sibling, or they may be mourning about a wife who has passed away even 5 years ago. And
Right.
when family says, what are you mourning now for?
Mm.
Mourning doesn't need time. Mourning doesn't need time. Because he did not mourn 5 years ago, he is
Right.
mourning today. And this is what we need to understand. And these are the kind of awareness that needs to be brought
Right.
the to the elderly sector of people. The youngsters have become more open towards it and more talking about it. And openly speaking about it is actually helping, our cause
Right.
here at Pran Wellness itself. That is what we are trying to do.
Yeah.
Yeah, so that's what it is. You
So
want to add anything there, Anshu, or
no,
can we
I
just move
think,
to the next?
yeah, we'll just move because last question, if we can have just 2, 3 minutes on. So,
Yeah.
as you said, with so many people passing out with a psychology degrees in counseling and all this background, but there is lack of training and, lack of skills, as you also said before in one of the, when you answered. So, do you think there should be some regulatory bodies which, train these counselors on their skills and, check on the what do you call on the advancement and the improvement of these counseling sessions on how well, what quality, how we can assure to have a better quality of counseling sessions which we are giving to the clients.
Very true, very truly, asked. And I would just say, we as counselors, there is American Psychology Association, so APA, where, they follow periodical testing for counselors,
Right.
periodical test for counselors. They have been sent into a different levels of testing, and also there is a once in 5 years, there is an exam that each person has to pass. They have to revisit their skills. They have to pass those grid. And once they pass is when they are allowed to be there as counselors. It is not an open slate that once you've done psychology, you are a counselor. It doesn't happen like that. So those are the kind of things that need to be brought for us to have a check, because we are also exposed to so much that we also need to be rechecked, and that we are not going to do, and we are not going to recognize ourselves, because we are just going on to do with this mental health, and we are here to keep on helping. So these kind of checks need to be done. There should be a test, which it is there in America, in USA and all that. Those kind of things, if it is brought about to us, and we are also told to revisit, and we also have to pass those tests, will give us it's like a license that we are able to renew. We are able to renew, like we renew our passport. We need to renew our license too, renew our position as being counselors. So I think something like this is definitely needed. I think it's not a one-time pass. It's not a one-time certificate. It is a periodical check that needs to be done. And definitely the question is a very, very valid question in this field. What experience we have and what we are facing, we need to be having these kind of regulatory check, like how we have a body check. We need to have our quality check also, and that is most important. And attending different sessions of training from different departments, going to different kind of seminars and all these things. It's something, workshops is something that we from Pran Wellness itself, we are trying to do. We are counselors itself are trying to attend on all these things. And I'm sure that other regulatory ways are also being followed by other wellness centers and therapists and all that. But definitely we need to have a check on ourselves. It is definitely something that's needed. Don't you agree, Anshu?
Yes, one more thing to add on, as you said, yes, we do have to keep, enriching our knowledge and brush up on our skills by attending more and more webinars, taking trainings on various subjects related to counseling and, psychology related stuff. But one more thing, what I wanted to add is, we as counselors, we also take supervision under other psychologists, and that supervision really helps us to know our own biases and prejudices that we carry. Actually, that helps a lot when we are undergoing supervision. So we do have a regular supervision sessions with other psychologists. So that is one more thing that I wanted to add here.
Yeah, and also we have counselors who come and give us periodical training also, isn't it, Anshu?
Yes,
we have our counselors who come and give us periodical training, so that way we are able to keep in check with our therapy ways and our systems and our knowledge too. Yeah, we also do that. Yes. Yes, Anju, I think we've
So,
answered all the
yeah,
questions.
so that many questions we could cover. Thank you, Anu, for answering and giving your insight on all these things. I wanted to appreciate one of the volunteers, Amna Khan, who had put these last two questions. So that's the reason I included it last in the session.
Yeah,
So a special
yeah,
thanks to her as well. So as we can
yeah,
see, the volunteers are more and more enthusiastic and, have that just to know more about counseling and psychology and mental
yeah.
health.
Yes. Thank you,
Thank
Anshu,
you,
for
Anu.
initiating this conversation and enabling this talk show. And also, thank you for all your inputs and insight. It was very valuable, and it was a very informative session, I would believe. And we would wish our volunteers
Yes.
to send us more questions, and we can do more
Yeah.
sessions of this kind.
Thank you all. See you all. And me and Anu and going to a hill with a book and a chair. We'll have our day, the rest of the day there, I think, Anu now.
Yes, we shall do that. Yes, good idea.
Yeah.
All
Thank
right.
you. See you all for the next
Thank
session.
you.
Take care.
Yeah, see you all soon. Take care.